I might get a comma first. Do you find on lower molars the canal, medial canals actually more buckled than what you would think?
Apex located.
No.
We're lucky because we actually look at this. You can see how it actually does wide curve. And you roughly, without cheating, if you could look at the tube, you would want fibre and that exactly. Yep, exactly right. Create a bit of a path. And then make sure the instrument is set to 500. In terms of torque, I leave it about 2.5, which is, you know, 3/4, between half and 3/4 torque, Newton centimetres. And you basically, because it's such a fine instrument, you don't want to put it in running and then try and put it into the canal, because it can bend and buckle. So always place it into the orifice first, and I always place it down until sort of resistance, and then pull it back a little bit, and then turn it on. Does that make sense? So don't just dive in there with it spinning around, because you need to have some control. Whenever you're using rotary files, you always want to have a really good sort of finger rest as well, because you've got to start to feel the rotary instrument, see if it's pushing on you or it's wanting to pull you in. So put it down to resistance, pull it back a little bit, and I normally do two passes, and you can see how much debris there is on the instrument just from a couple of passes. So this instrument is really going to do a lot of your, basically a lot of your cutting essentially. Oh yeah. So same thing, 1, 2 passes, get out, re-irrigate. I'm going to skip that step. And then you go back to the size 6 basically. And the size 6 watch winding, in this case we'll dive all the way through. But you would get the 6 and then you put an apex locator on and get your length. See how you're sort of using a watch winding motion to get down to length, and then an up and down reaming motion once you've confirmed sort of where you are. Now, for this case, if I got to the point where my size 6 didn't go any further, okay, so let's say you're going 6, 8, 10, and you get to the point where it's blocked or ledged, then you need to put a curvature, on an apical curvature. I put an apical curvature usually on a size 8, okay, because the size 6 sometimes is a little bit too soft and flimsy, because when you put a little curve in the instrument, you want it to hold that curve, and the 6 doesn't always do it. So, do we have tweezers? Can I borrow some tweezers, please? Okay, so the way I would do a curve is basically grab the tip of it as well as the smallest little bit you can. So, see that little curvature, and see how the little arrow, the little marker is to the direction of the curvature. So when that's in the canal, you know whereabouts the orientation of the curvature. You can see that's beyond the apex. So from there, if I get that around the apical curvature, get that loose, And then I always, after the 8 goes down there, I don't always put a curvature on the 10 because sometimes the 10 will go there because you've created a path. So so basically same thing, watch wind, and if you find it hits that same ledge, don't push it, pull it back, put a small curvature on the tip. And then get beyond the little point of curvature. And then once it's beyond the curvature, basically a vertical motion to remove any sort of that irregularity. Make sure there's irrigant. And then take the glide path file all the way to length. And the key is to make sure it's advancing with each path, each pass. Re-irrigate. And this, once you've got, this takes time to get to length basically, because it's doing all of the work. But once this is to length, the 2004 goes down very quickly and easily, and the 25 goes down very, very easily. So you just sort of have to be patient with this instrument as it runs. Can't even see if it's when it's beyond the apex. Get it out, clean it, re-irrigate. Oh, it's well beyond. Re-irrigate, and then basically, and then the beauty with this system is that you can, it's not one size fits all, so you can select what size you need to finish to. So in an MB2, I would only go to the size 20 after that. So size 20 instruments, a constant taper, it's 04 taper. And same thing, take that down 1 or 2 passes and it generally runs down there. If you've got the 1004, if the 1005 has gone down to length, the 20 will go down easily and the 25 will go down easily. Does that kind of make sense?
Irrigation.
Yep.
What do you use the 30 gauges?
Yes, I use these that I actually use the ones we've got here, which are I think a 30 gauge. Are these the 30 gauge?
Like a 30 gauge.
Yeah. 30 gauge, and they're side port as well. That's the key. You want it to be side port so it doesn't sort of get inadvertently extruded.
You know, it's fine for a bigger canal. You get that one tap. How far is it recommended we get the irrigate, needle down? Or we rely on transportation for the file or these, like how do we? Well, there's that apical
Couple of
void,
Yep.
that's-
Yep. So this is where having a pool of irrigant, your file has to try and take the hypochlorite down there. So you need to have a pool of irrigant that you're working through each time. So I basically have my chamber half full. So the only time I don't have heaps and heaps of hypochlorite in the chamber is when I actually can't see the canal. So do you know right at the start where if it's full of hypochlorite, you can't see where the canal is to get your instrument in? So sometimes the first time I put the glide path file in, I'll let it run in in a couple of millimetres with no hypochlorite, just so it creates a little bit of an orifice. And then once I can actually get into it again, I just fill it up with hypochlorite, and I'm working through that. But in all but the most curved canals, this sort of 30 gauge needle goes quite a long way into the canal, really. Because a 30 gauge is roughly about a 35 from memory. So that even in a 2004 prep, that will go down quite a few millimetres. But then at the irrigation stage, you're then relying on the endoactivator or ultrasonic to actually help distribute that hypochlorite more than the can. No, sorry. So prep your canals quite large. Do we have in those kits some 40 instruments? You know, 40 instruments. Okay. Could you maybe are they the EDMs? Yeah, cool. Have a look. So prep your kits only have to a size 30. So prep them up to a size 30, and then there's a handful of the EDM size 40, 04 rotaries. Have a look at them and just see how soft they are. They actually feel like plastic and polymer. And then prep your canals to a size 40, and then we'll fill. Once everyone's prepped the canals, then I'll do the warm vertical sort of demo.
Why aren't you using exclusively EDMs?
Because they don't have the 20 and the 25 size. So the EDM set, the manufacturer's EDM set is a glide path file and then a variable 25 file, which is basically like an F2, X2. So it's quite tapered, and then it's these bigger files. And I don't like, as I said before, because of the pericervical dentine, I don't like the big tapered instruments. Whereas these are much sort of thinner. They've got a smaller sort of flute diameter up here, so they remove much less dentine, about 30 to 40% less dentine up there. So for me, that's more beneficial. Because the only canals I'm going to use a size 14 are the big ones anyway, like usually, which have a lot of two structure. But I want you to do the size 40s here in all of your canals because the obturation are matched to a size 40. So if you're going to buy the obturation kits, you get a smaller size, which we can talk about, but because of the demo ones are only a bit bigger. So
you're saying the only heat treated file we need is the glide path?
No, these are heat treated.
These are?
Yeah, they're all heat treated. All the HyFlex Coltene ones are all heat treated.
CEM and EDM are both?
Yeah, and then the EDM is that new electric discharge kind of technology. So that'll be. But apparently they're Coltene are releasing a size 20 EDM file. That'd be really nice because then you can just stick to EDMs. Great. Thank you. So basically, can we zoom out a bit, please? So these are basically the instruments. They've got a hot little tip. You can adjust the heat, what heat you want it to go up to, but it's anywhere from 150 degrees to about 220 degrees. I do mine on about 180. Okay, I don't think it really matters either way what you do, because it's still bloody hot. I think the risk of 220 is that it's going to be sometimes if you leave it in there for a bit long, it can cause some damage to the ligament. But either way, as long as you're not in there for a long time, it's okay. But you basically either one of these buttons you press and you can hear it heating up, and you can look at the number. And it heats straight up to 200, and then it will stay on there while you're holding the button, and it's beeping. So when you let go, it cools down very quickly. And it's not hot. Okay, so that's that. And there are various tip sizes that you can get, anywhere from like a 3004 to I think a 6008, so a really big tip. And you kind of I think it's best to have sort of 3 tips in the practice: a small, a medium, and a large, or maybe just a small and a large, because you don't. For like a mesia buccal of an upper or lower, you really want a smaller tip, but for a central incisor, you want a large tip, because it can be a real pain in the bum if you're trying to do a large tooth with a very small hot tip. And if you get to the point where you're looking at buying one of these, if you just send me an email, because there's a whole range of things that you can buy, size tips, tapers, etc. If you end up getting to the point where you want to buy them, just let me know and I can send you an email or just have a chat about which sizes to actually buy before you do. So that's the hot tip. Even if you don't do warm vertical obturation, this is really useful. Even just to burn off gutta perca. It's a lot easier than heating up a flame and then cutting it off. This here is a gutta perca gun. It's a cordless one. There's lots of different types. there's mainly the two types are basically a mechanical one, so that's a bit like when you hold a button and it sort of there's a little micromotor that pushes out the gutta perca. These are manual, like the gun sort of style. I like these more because you get some tactile feedback. So when you're injecting the gutta perca, you can sort of feel it push back a little bit. Yep. Yeah, you can use them both. Yeah, because with this tip, you can actually bend it. So there's a little wrench to sort of bend it at whatever angle. Yeah. Turning it on, is it low? Is there gutta perca in it? No. Okay. So it's kind of like a rifle. If anyone's used a rifle, there's a pin that basically comes in and out, and the staff need to know there's quite specific care instructions for it. It's not difficult, but they just need to follow it. Basically, the instrument heats up. There's a heat guard here to sort of protect the patient's lip, and then the gutta perca goes in that little. And then that just basically closes on top. Cool. And then once it's hot enough, if you just pull the trigger, sort of gutta perca comes. Let's change that. Gutta perca then sort of comes out. So if you can see, these are little demo blocks you can just play around with to get the feeling of what it's basically what happens with the gutta perca, but you can kind of see it. Okay, so you can kind of see how the gutta perca actually flows. You can't see, sorry. There we go. Kind of see how it flows into all the irregularities. So, warm vertical. Can I have a gutta perca point?
Got it in a gym. What size do you?
Maybe a 40.
40.
Yes, no. By 35.
You listen to these babies.
Oh yeah.
Oh.
So you can have a play around with the injectable stuff on this little block. Cool. Okay, so gutta perca point goes in. It's length controlled, as per usual. The next step is to dry and irrigate. You do final irrigation, which is EDTA with an ultrasonic, and then hypochlorite with an ultrasonic, and then dry the canal. I use alcohol just because it dries it quickly, but if not, just paper points, and with that little micro suction helps as well. But the first thing is to basically stop it. Is to basically work out how deep that it's actually going to go, because there's no point sort of over trying to pack more and more if it's taper locked, because what's going to limit how deep it goes is actually the size of the instrument, basically. So In this case, it can go down to, 9 millimeters. So that's about 4 millimeters from the apex, which is good. Okay, which is ideally we'd like to be about 4 to 5 millimeters, but we're limited by the canal curvature. So in a really curved canal, it's impossible to do warm vertical compaction because you just can't get an instrument around that corner. Master cone gets placed in with just some sealer coating it, and I watch wind it in to length. Just ignore the extrusion, I'll adjust it later. And so basically the first bit is you heat it up. Can everyone hear that? Yeah, cool. Because that's kind of key, is to know when you're heating. But heat it up, place it in just a couple of millimeters and wipe out the excess. Okay? Before you even go into the canal, just make sure the orifice is clear. Okay? So don't start putting in the hot tip if there's still bits of gutta perca hanging out the pulp chamber, because you really need visibility with sort of within the chamber. And then basically you repeat that process, sort of sequentially burning it out deeper and deeper in sort of 2 millimeter increments. Sorry, that water's stopping it coming out. So if you get to the point, so I'm getting closer down to depth, but you see how it's not coming out anymore basically. So what you can do there is actually just use the plugger, let it cool, and then use the plugger to basically compact, compacting that gutta perca. Can you see? That's all right. Oh. So you can kind of see the gutta perca about 4 millimeters into that orifice. And after that, you place that over the GP, inject slowly. Compact with a cold plugger, and once again you're just holding it with gentle pressure. And these pluggers they're different size pluggers as well. Generally, these B&L ones, they're nice because they've got a larger plugger on one end or a smaller on the other. And warm vertical.